Derana 24, Sri Lanka's news channel.
And the biggest news we've heard tonight, the entire island will go into a state of lockdown from 11 p.m. tomorrow and remain in place until 4 a.m. on Monday, the 17th of May. With that, I've invited to our studios the head of the National Operations Centre for the Prevention of COVID-19 Pandemic, Army Commander General Shavendra Silva, to give us some clarity on what is ongoing and the decisions that have been taken with regard to the restrictions. A very warm welcome, Commander. Thank you for joining us.
Thank you for inviting.
I think the first question that everyone has in their mind are also the concerns and fears whether the government is planning to go in for a gradual long-term period of lockdown as a result, as an initiation of these restrictions introduced today.
No, not at all. But only thing, we never know. As of, according to the situation of the country, always the decision will be taken accordingly. But I believe that as of now, according to the health experts, the advisors and the recommendations given, and also we are heading toward a long weekend, a travel restriction was imposed, not a lockdown. Travel restrictions were imposed, and thereby we are trying to prevent a spread in case if we have, and also people would like to over the weekends as usual. However much we tell, you know that even the last weekend we found that people are going and trying to hang around with people. So this is a way of giving a bit of a restriction to be at home and to ensure that people will not come out of the houses except for essential services. And also especially this has been given an opportunity for people in the Western province to get their vaccines. So we are on a bit of a vaccine program these days, and people who are going to work at times, they miss the vaccination program because they are working, and this has been this is opportunity that what could say.
Does this mean there won't be any impact onto the ongoing vaccination program, the mechanism that is in place as a result of the restrictions introduced?
Not at all. We have clearly informed during this when we imposed these restrictions or the instructions in regard to coming 3-4 days. We are informed that in the Grama Seva divisions where the vaccination programs will be held, anyone who is in and around that area can either walk and go or go in the vehicle. Grama Seva divisions are very small. In Colombo, maybe a little bigger than that. But still, we have given the facility. We have informed the police and the military who will be on alert that these people will come. So they can go into centers and get their vaccination. That is the aim of actually, especially in the Western province, the aim of having this type of a travel restriction so that they can easily go and get their vaccination.
I'm sure this is something that you've answered quite some time also since the Aurudu, the festive season, the season where we saw a rapid increase of cases that were reported. Did something happen? Did something go wrong in terms of how we manage the situation for us to see the increase in cases at present?
Not at all. I don't think. I mean, you know that we always, those who usually come on TV and discuss about the COVID-19, we have informed from the beginning of April that although we are having about 150 to 100, this varied from 100 to 150 numbers, first week of April until the first Sinhala and Tamil New Year, we inform that the people have to be very careful, although we are having a small number, that at any given time, unless you behave, unless you wear your face masks, and unless you avoid gatherings, that at any given time this can go up. While doing that, we saw that the neighboring country, India and various other countries around the world, there was a hike. So, but I think the government of Sri Lanka, His Excellency the President and the government would have decided, thinking that we have not had the chance of giving an opportunity for last 2 years to have the New Year at least with the family. We told this New Year should be with the family and not even with the relatives, we told. So having said that, by knowing, I don't think that people can always say that we didn't have a mechanism. We had a mechanism. But in the other way, if we did not have this hike at this time, people would have said, we had only 100 cases in the entire island, but still we didn't give the opportunity for people to have their New Year even. So, like last year, what we were doing. So, therefore, this is a democratic country. Although these are health things are there, we were trying to give that opportunity, giving all types of information, informing that this will at any given time go.
How do you respond to criticism that authorities have not done enough to curtail the situation before it became this worse in our terms? Because Sri Lanka, we saw Sri Lanka managing the situation earlier in an exemplary way. And also another question coupled with this, it is said that you take decisions mostly on the COVID-19 program and the mechanism. Are you really in charge of all these decisions that you've taken? If so, are you the one who should be responding to these criticisms?
Yeah, no, let me start off with this one. It is not like that. These are, you find however much we do, you get criticism is a common thing. This is a democratic country and people have the right to express their views. But whether they are expressing what the views are, whether true or not, or whether they are fair or not, is for the people to understand and to decide. But the fact remains that I am not alone. His Excellency the President heading the COVID-19 entire program, His Excellency the President, thrice a week that we meet, even yesterday and tomorrow also we are meeting. So here the entire thing has the President of the country, unlike some maybe other countries maybe having committees alone, but President get involved in everything. Definitely, but it is not like that. We have a committee and we always listen to the experts. This is because a very brief interview. Let me say the last decision that we took in regard to the travel restriction yesterday. That was for that meeting with the President, the Sri Lanka Medical Association, the President and their members, the GMOA, Government Medical Association, all the experts of the medical field, so those association heads, epidemiology unit heads, then in the Secretary Health, 3 ministers who are in charge of 3 different areas in the health, we all of us were there. Then thereafter only a decision was made. One can't do that. Who am I to take decisions like that? I'm only the commander of the army.
So you don't take arbitrary decisions?
No, I don't want to. Why should I do that? I'm not having such authority also, but everything being told to the committee and also with the, in concurrence with the Secretary, the Director General Health Services, we take this. We are working as a team. But only thing, most of the thing, even in your Derana, like highlights, they will inform the commander of the army. So they must be thinking like that. I'm a part of the team, I'm a member of the team, but I'm not taking alone.
Allow us to go in for a short commercial break. To stay with us, we're in conversation with the commander of the Sri Lanka Army, General Shavendra Silva. VIP treatment. Yeah,
in regard to the VIP, there is nothing like that, because first of all, the things we are giving is right now is for the frontliners we started off. With the Sinopharm vaccine, now we have started for the strategy is that most vulnerable areas during last 14 days, the highest number of patients are getting from Western Province. This is focused to the Western Province first, 3 districts of the Western Province, of which all those vulnerable areas where the highest number of COVID positive cases came from during the last 14 days, those are the targeted areas for vaccination. It's not like you ask whether some people have not got, maybe that area is not vulnerable up to now. You see, so therefore the most vulnerable areas will be given. We go to a Grama Seva division. We started off with this and we started on 2 days back. We were vaccinating about 2,000 per day. Then His Excellency the President called and told that this has to be faster than this, because we have the vaccines and we should go ahead with all these vaccines for the people. So we employed all 3 services, Army, Navy, Air Force, and yesterday we have vaccinated over 50,000. Today we have vaccinated over 64,000. So we are nothing, but we don't have to go for this, as you said, VIP treatment. You know that people will always talk. If somebody has evidence to say that there is a VIP lane or given like that, they can take a picture and send it to us. This should be interrogated in that and see whether there is such a thing. But for us, we have not been reported. People tell like that. But where to? We have not seen such things.
How are we managing the situation of the shortage of hospital capacity or beds, or the capacity to handle the rising number or the increased number of cases that we saw in the past few days?
Yeah, we had only about 5,800 odd beds in the government hospitals catered for COVID patients. But now we have increased that by about another 15,000. We have given for ICCs. From the military we have given, and also some other agencies also have come forward and given us. So we have the capacity for already as of today about 25,000. We have created about another 5,000 as of today. So some people say, why beds? Why beds? People are saying, why beds? Criticizing why beds? It is not only the bed is required. No, beds and the staff is required, and we have deployed all of them. But the fact remains that not everyone go to ICUs. You see, even ICU beds we had about 110 catered. As of now, I think 67 or 70 are occupied. Balance is there. So we are increasing the number depending on the situation. So we can assure you the people of this nation will be not put on ground. We will make sure that some or other we will give a bed and look after them on a bed. And the doctors will go all around, ensure that people will, death rate will be brought down as much as possible. So, but we will ensure that we will look after the people of this nation who get positive in COVID.
I think there have also been talks about foreign nationals. With recent restrictions introduced, also there will be a quarantine period mandatory for those visiting Sri Lanka. With that, what kind of measures will we go into when dealing with incoming tourists or even citizens visiting the country?
Yeah, for tourists, there is a system of bubbles. We have practiced this with the Ukraine thing a long time back, and we have got the experience, and we are doing that. So they will have to go in a bubble for 14 days, and that is how it goes. But for Sri Lankan nationals, earlier it was said only in hotel 7 days and other 7 days at home, and for government quarantine 10 days and 4 days at home.
Right.
But here with the new instructions, because of the new variants that people are worried about, and the specialists, the doctors, the medical specialists have given us advices and also recommendations that everyone who is entering the country should go for 14 days quarantine. So as of with effect today, we will go for a 14 days quarantine, and to ensure that this variant will not get into the society.
I think that's all the time we have. But before we go, is there any message that you want to share with the general public, also our viewers watching tonight?
Yes, in the very that the most important is that with all the difficulties, the government has given us opportunity for next 3 days coming starting from tomorrow night, that try to curtail as much as possible with certain strategies to be implemented. We request the people of Sri Lanka take this opportunity not to be not to hang around, not to come out of the houses unless you are working on essential services or you are on an emergency. We request the people to be at home and cooperate. And we are a great nation. We can always win. We have never been defeated, although whoever who says we have never been defeated, and we can certainly win this situation. Even like the first wave, the second wave, third wave, we also will definitely win very soon, provided that the people will adhere to the instructions given by the health authorities and cooperate. Then we will see that very soon Sri Lanka will be free of COVID.
Derana 24, Sri Lanka's news channel.